Hello, my name's James. No, I have had epilepsy long, but I don't feel like I have it now. And I feel a lot more freedom because I can do a lot more things myself now. And I can go out more without telling my carer where I've gone. And I don't need his help as much. And I've got his help when I need it. 4 years ago, I wouldn't have been able to do this sort of thing. So I'll pass you over to Andy.
James was in residential care virtually all his life until he joined Shared Lives and our family in 2010. I drove James away from the residential centre on December the 15th, 2010, remember very well. And he came to live in Hertfordshire. He's absolutely right. 4 or 5 years ago, James would never have been able to get up in the morning to catch a train at 8:20 to get here and do stuff. And yet he's still on the same medication, exactly the same medication for his epilepsy as he was 20 years ago. Absolutely.
Our public services were started in the poor laws, and we used to build big buildings to separate people. So we used to separate people very visibly into people that we regarded as citizens who could do what they want, but perhaps couldn't get the support they needed. And then we built big buildings like orphanages and workhouses and asylums. And put people in them. And we don't do as much of that anymore. We still do some of it. We don't do as much of that anymore. A lot of those long-stay mental health institutions have been demolished or turned into luxury flats. But actually, those divisions that we make between people we regard fully as citizens and people we regard in some way as wards of the state, I think are still deeply embedded in our public service systems. And I think one of the things that's interesting about the work you started to hear a little bit about today, and that I'm sure you will have other kinds of experience with in your world as well, is actually, can we do something different to that? That doesn't add up to a good life. How can people make connections if they're going to need support for an extended period of time? How do we offer people a small number of consistent relationships, not a succession of strangers? And to do that, we're going to have to value some different things. We're going to have to start really valuing well-being, people living good lives, and not just some of the things that we currently value, which can be quite medical and quite a narrow list.
It is about different ways of doing relationships. And for some people within the world of services, this is liberatory because it's the sort of relationships that they always wanted to be having with people. For other people within services, it's actually really strange and challenging. And I don't think we should underrate this. We've had a very warped world for about 15 or 20 years now, which got increasingly dominated by not the actually intended, but the unintended consequences, I think, of the NHS and Community Care Act.
So now I'm an advocate for my own health. I'm in lead of all my care, so I go into my consultants and we have conversations, and our relationship's improved. They're on the same level as me. I don't put them any higher, any lower, so we're equal and we work out our care. Thanks to having wonderful new relationships, thanks to me being in control and in a driving seat, thank you to a very remarkable boy, I have a life where I live every single day with so much passion, and it's a life where I am living and not just existing.
When I had my second social worker, he spoke to me as a human being, not just the person that was on the paper.
Where we sit in the construction of being a professional within a professional identity and whatever we think our social work is about, you know, the issue around helping and what is the thing that we can do that could be of the best, most use to people on a journey that they're on? Is it something liberal and soft and silly to talk about about helping? You know, is it supposed to be something more than the human condition? Because that's what we're always doing in our private and personal lives. We're always helping each other all the time.
So you could say that today is about supporting the emergence of the new. You are showcasing different ways of doing things. You're bringing together people who have different approaches so that together you are stronger, and you're showing what this new system, this new way of working can look like.
I think what we struggle with, we've got this kind of role of the peer and the professional, and that the peer is the only one that can share lived experience or has lived experience. And there's a really big barrier as a kind of professional, like I can't share anything about myself, like that's my professional role doesn't allow that. And I think that stops us from having meaningful conversations.
I think for me, it's really important to conceptualize practice as something that's shaped by principles rather than sort of methods and techniques. I know there's an interest in that, but fundamentally we're engaging with people in their own context, in their own lives. So there isn't a single formula for that, I don't think.
In order to fix things right at the beginning, we went down a route that quite a lot of other people do, which is to say, let's get compliance sorted out, let's follow processes in the way that we should be doing. And in that process, I think what happens is there's a bit of dehumanizing of people, and probably periods of time when kids are coming into care that don't need to. And I think that that's happening still at a national level. I think that we do have far too many children in the care system and far too many coming in when there isn't a necessity to do so.
So I know there's a panic for people around moving away from a way of working where they're very used to systems and processes and things being divided up. So there's nothing relational really going on, although there were beautiful relationships that people make because of the skills and care they have.